For over 25 years, researchers in NUI Galway have been recording and charting the lives of Ireland's children and young people. The Health Behaviour in School-Aged Children study is headed up by changemaker Saoirse McGowan.
Our team at NUI Galway focuses on children's health and well-being. Children have the right to be involved in decisions about their lives, according to Irish national policy, but also the UN Declaration of Human Rights for Children. So we include them in every aspect of our research, from making decisions about the kinds of things we research, right through to policy and practice, and ultimately improving their lives.
The team is bringing together groups of school children from all over Galway as part of Europe's largest survey of children in 2022.
What we're hoping to do with you is to set some priorities for what kinds of questions and what kinds of issues we should be asking young people in Ireland about.
Ruth, Alva and Aisling are students of the local Salerno Secondary School, Salthill, Galway.
Well, we think these ones are the most important.
Yeah, like eating and dieting is very important.
Especially this day and age.
With like social media and stuff, so we think that's very important.
And mental health and well-being because
you know that's like everything kind of.
And like school is a big part of our lives.
Yeah, school's massive. Like it's like a main part of our lives at the moment.
Well, there's a whole range of different issues. One is COVID, I guess unsurprisingly because of the time. One issue that's come up is environmental health and the health of the planet. One is about health literacy and how young people use information. So a whole range of different things are being included, 17 different topics. Whatever you think is important, you put a red dot beside it, and if you think it's really, really important, you put more red dots beside it. It's kind of exciting. I can't see them. I'm just dying to see what's on them. No. Okay.
You know, it's their right to be involved because it's actually going to impact practice and impact policy in Ireland. So children should have a right to be involved in that because it will affect them. And so together with them and then the researchers, we can make a much better research study and have therefore, I think, better outcomes for young people today, but also in the future. So it impacts both what's happening in practice, so that might be in schools, but also policy, so it'll be fed back to the government as well.
Yeah, there's been a lot of changes since the mid-90s, to be fair. So in terms of children's behaviours, they're really improved in a lot of areas. So much less smoking, much less drinking. Relationships are much better with parents than they used to be. Same with school. There's more places for them to go and play, to have recreation. So life has changed for the good for most young people. And there's some areas that haven't improved and it hasn't been an equal improvement for all children. So there's a fear about some children being left behind. What does it say?
Health literacy and eating and diet.
Okay.
Hang on.
Yeah, I think because like we're children and like we have like the adults might think something different. Like the adults were saying that they didn't think things that we put up like first would be important to us, but they were. So it was good that we kind of had an input on that.
And she was saying like she wouldn't have picked them, which is good that we had the input because now we picked them and now they might be in the survey and it could help some other kids as well.
Their number one was mental health and their number two was school. They were almost equal. It's very hard to look into the future, but in terms of driving the change, I think we need to put children right in the middle and to the front of making that change. More researchers, more policymakers need to listen to what children have got to say, really genuinely involve them in decision making, but also involve them in the process of rolling out change. That's the way we're going to improve things for young people and children in Ireland. I think this work is life-changing, but it's life-changing not at the level of the individual person or the individual young person. It changes the settings where they live, where they learn, where they love, where they laugh, where we live our lives. That's the home, the community and so on. And that creates greater opportunities, more equality and so on for young people to explore who they are and develop themselves.